Hi, I am Gina and I'm a nurse practitioner and anti-aging provider at Elevate Functional Medicine in Suwanee, Georgia. So today I want to talk to you briefly about microneedling and microchanneling, what those things can help, who does them, and how is what I do a little bit different. So microneedling is a procedure that's been around now for quite some time, and you can see some estheticians will use like a roller on the skin. You can even buy home rollers, and the rolling head has these little needles in it that are going to punch holes in your skin. Then there are professional devices that you can use. I can't name any, of course, but there are devices which have an electric head, and the head goes up and down very, very rapidly, and then a provider will drag that device over your skin in order to theoretically punch a bunch of holes into your skin. The reason that holes are put into the skin is for two reasons. The first is to try to deliver growth factors, antioxidants, collagen boosters, hyaluronic acid, to try and get that down deeper into the surface of the skin to promote healing. The other thing is that if you damage the skin, then you're going to promote a healing cascade, which will then allow your skin to repair those little micro needled areas, and that in and of itself can help to even out skin tone. It can help with acne scarring, and it can help boost collagen, so helping to treat fine lines and wrinkles. So that's what microneedling is. And you can get that done anywhere from an esthetician up to a medical doctor. So it just really depends on the level of education, what type of a device somebody is going to use on you. So I have performed microneedling in an aesthetic practice, and I did not particularly prefer using those type of professional devices because I did not feel like I had the kind of control over the outcome that I would prefer on a patient's skin. I also saw patients leave the clinic bruised or with abrasions or with some areas that would end up scarring, and I did not like the microneedling process. Particularly, I did not like dragging something over the skin that had an electronic head. I did not feel like I had good control. So when I had an opportunity to start doing some more research into different devices to find what type of a device I was interested in, I came across this little device here. It's called Procel. The difference is that this device is strictly a stamping device. And what I like about it is that I have total control over over how this device is used in terms of being able to deliver specifically small channels into the skin exactly where I want. This device is not dragged across the skin, it is stamped over the skin. So there are no abrasions, there's no scratch marks, there's absolutely no trauma to the skin that can actually lead to a negative effect. So I really prefer a stamping type of a device. Then what I do is all of my treatments are done with a compounded serum, which I can get made specifically for patients' skin types, or I also have an anti-aging compounding serum, which I just carry in the clinic. Then I mix that serum either with what we call platelet poor plasma or with platelet rich plasma. So what does that mean? So for every patient who comes in order to get one of these treatments, I draw their blood. The less expensive route to go is getting something called platelet poor plasma. So in order to do that, we just draw your blood into just a regular little tube and we spin it down. And then that separates the red blood cells out from the plasma. And then right in this, what we call a buffy coat, so this little space between your red blood cells and your plasma, that's where your platelets rest. The platelets are the type of blood cell that carry all of your growth factors. And the growth factors are what we want in order to really help promote an excellent rejuvenation skin procedure. So the growth factors have all of our healing properties and can really help to build collagen, reverse the signs of aging, even out the skin tone, even out acne scarring, reduce fine lines and wrinkles. So every patient is going to have their own growth factors used on them rather than a purchased growth factor from a company. So I take your growth factors, I take your own plasma, and I mix it with a special serum, and then I use that to microchannel that into your face. So that is the microchanneling with the platelet poor plasma. Then the other option is to have this procedure done with platelet-rich plasma. So the difference is that these tubes are specially made with a medium in them that's going to make sure that when we draw your blood and we spin it down, we get a defined, really high concentration of your platelets. So that's very hard to do in just a regular blood draw. So this will have a very specific tested amount of your platelets that just really lets us know that we're having very rich growth factors in the serum then that we can put on your face. But even when I do microchanneling with your platelet-rich plasma, I still mix it with the additional compounded serum so that we can really deliver antioxidants, hyaluronic acid, and other beneficial nutrients deep into the skin. Then following every one of my treatments, we will cover your face at the end of the treatment with that final mixture, and then we put on a mask, and then we have you rest in the clinic for about 10 to 15 minutes with a mask on, just to really make sure that we get those growth factors and those antioxidants and other beneficial skin nutrients down into the skin. So that is how we do, or I do, the microchanneling here in the clinic, and I think it's a wonderful device, and I'm really excited to be able to offer that to you.